Hi, my name is DanWachter. I'm a Maryville University student, and this is my head-to-toe assessment. Um, Beginning the assessment, I asked my patient to empty her bladder. I gathered her vital signs and got her height and weight. I also started with a general inspection, noticing her posture when she walked in, her affect, and her hygiene as well. To begin, I'm going to start by assessing the face, facial features, and skull. I want to look at the skull, make sure that it's normal cephalic, that I don't see any lumps or anything like that. Also want to look at the skin, make sure there's no signs of lesions or anything like that. All the way around, especially around the hairline. I also want to inspect the facial features, making sure that they're symmetrical. I want to see that the inner canthus of the eye is about parallel to the top of the ear, which is normal placement. After that, I am going to move on to palpating. Palpating. I want to palpate the facial bones of the face, feeling for any tenderness or anything like that. I also want to palpate the sinus regions, such as the frontal sinus and the maxillary sinus, making sure that there's no tenderness or anything there. We're also going to palpate the temporal mandibular joint, making sure that there's no popping, locking, or crepitus. Can you open your mouth and close? Very good. So after that, we're going to do a few cranial nerve tests. Can I have you smile? Have you puff out your cheeks, squeeze your eyes shut, and wrinkle your forehead. And this is going to test the facial nerve. After this, I'm going to have her bite down and clench her cheeks. And this is going to test the trigeminal nerve. And we're also going to do light sensation touch on her face. Can you feel that?
Mm-hmm.
That? And that. Perfect. And then finally, I'm going to have her stick out her tongue. And I'm going to notice that it is midline, making sure that the movements are symmetrical back and forth, and that is checking the hypoglossal cranial nerve. After that, we are going to move to the eyes. When we first look at the eyes, we're going to start with inspection, looking around the eyes to see any signs of infection, looking at the eyelids, looking for any signs of blepharitis or anything like that. We're also going to look the eyelashes, for blepharitis, and then the eyelids. We're looking to see that if they do come down, that they come down only over the iris and don't extend over the pupil. We're also going to look at the sclera, making sure that it's nice and white. We don't want to see any yellow or redness in there. We also look at the conjunctiva, making sure that it's translucent, and we're also going to make sure that there's no foreign bodies in there. We don't want to see any signs of redness or infection. We have a few tests to check the optic nerve. I'm going to have her read this small print to test her short vision, or near vision,
The Lindbergh High School National Honor Society.
Perfect.
The Lindbergh High School National Honor Society.
Perfect. And great vision there. We're also going to check for strabismus. And what we're going to do is I'm going to cover, it's called the cover and uncover test, and we're going to block one eye. I'm going to have her stare at a fixed object in the past. What we're going to do is see if that eye converges over here and there's no movement. Again, we'll try it on this side, and good, no movement. So there is no strabismus, no autocorrection after the eye is covered. We're also going to check the fields of gaze too as well. So can I have you follow my finger? Good, and that's going to check the trochlear, the abducens, and the ocular motor nerve. Finally, we're going to check we're also going to check the pupillary responses to light, making sure that the eyes constrict, or the pupils constrict. Perfect. And we had good pupil restriction to the light. We're also going to check a red reflex on the patient. So what we're going to do is look out here. We're going to first look for a red reflex. Can I have you look at a distance up in the corner of the room for me? And we're going to check for the red reflex. And once we find that, we're going to follow that in and look at the optic nerve. Make sure that the vasculature is branching away from the optic nerve, or the optic disc, not the optic nerve. But the optic nerve, or the optic disc, should be yellow to a creamy pink color. And also taking note of the fovea centralis if visible. We're also going to look at the other eye, looking for the same features. Again, following the red reflex, going in once you find it, and looking around, looking at the optic disc to make sure it looks healthy, the vasculature, again, branching away. Once we are done with the eyes, we're going to move to the ears. We'll start again with inspection, looking to see if there's any lesions or anything like that, making sure that they are symmetrical. We checked them earlier. They are symmetrical to her eyes, making sure that the placement is correct. We're also going to look behind the ears, making sure that there's no lesions or anything like that. Then we will move on to palpation. We're going to palpate the auricles, feeling for any lumps, masses, or tenderness, and that is fine. There's nothing there to worry about. After that, we're going to move on to a few tests to test her acoustic nerve. So we'll start with the whisper test. I'm going to cover one ear and whisper a word. Can you repeat it for me? Baseball.
Baseball.
And
Soccer.
very good. And her acoustic nerve seems to be intact. We're also going to do the Weber and Rin test. We'll start with the Weber test. I'm going to place this on top of your head. Tell me if you hear this on the right side, the left side, or bilaterally. Equally on each side.
Bilaterally.
Good. For the Rin test, this is testing bone to air conduction. And what we're going to do is going to put this on the mastoid process and tell me when you stop hearing the noise.
Now.
And then tell me when you stop hearing it in your ear.
Now.
This tests for bone to air conduction. Air conduction should be twice as long as bone.
Now. Now.
Very good. And that seems to be normal as well. After that, we are going to look inside the ears. We're going to look at the eardrum and the ear canal and the middle ear. What we want to see in the eardrum is that it's a nice pearly gray color. It's not red. There's no edema. There's no signs of infection. The ear canal as well should not be red, no signs of infection. It should be clear. There can be some cerumen, but make sure that the cerumen does not smell and that it's not completely occluding the ear canal. So we pull back on the pinna and insert. And very good, that looks good. Next we're going to move to the nose. We want to look at the nose first by inspecting it, making sure there's no lesions or anything again. Want to make sure that the septum is patent, or septum is not deviated or off midline. It should be nice and symmetrical, nice and straight. We also want to look at the nares, making sure that they are symmetrical as well, nice and level, making sure that there's no flaring of the nostrils or anything. Also want to look for any exudate or anything that could be coming out of there. We're going to occlude the nose and check the patency of the nares. Good? Good. And if I could I have you sniff this for me? And this is going to check the olfactory nerve, cranial nerve 1. Also going to be inspecting inside the nose, looking at the mucosa, looking at the turbinates, and looking at the septum. The mucosa and the turbinate should be pink and moist. They should be the same color, and the septum should be not perforated or bleeding or deviated. It should be nice and straight. After that, we're going to move on to the mouth. So with the mouth, we'll start by looking at the lips, making sure they're not cyanotic, that there's a nice pink color, they're moist, not cracked, and that they are symmetrical as well. We'll start by opening your mouth, and we're going to inspect the floor of the mouth. The floor of the mouth. Move your tongue, please. Making sure that there's no signs of lesions. We're going to look at the buccal mucosa, making sure that there's no signs of lesions or anything there as well. There's a nice pink, moist color to all the mucosa. And then we're going to look at the hard and soft palates, making sure that they're intact. We're then going to look at the tongue, making sure that she can stick it out and move it from side to side, symmetrical, nice symmetrical movements, perfect. And the tongue is a nice dull red color with a rough texture on top. We'll also look at her teeth, making sure they're nice and uniform, they look like they conjoin nicely, and looking at the gums, making sure that there's no signs of gingivitis or bleeding or gum infections or anything like that. Finally, we're going to look at the back of her mouth, and we're going to test the gag reflex and look at the uvula and make sure it's midline. And I have you say ah. And we're going to check the gag reflex. Good. Gag reflex is intact. Both the uvula and the gag reflex test the vagus and the hypoglossal or glossopharyngeal nerves. We're also going to look at the posterior pharynx, making sure that it's nice and pink. We're going to look at the anterior and posterior pillars and looking at the tonsils as well, making sure they're nice as pink. There's no signs of lesions. There's no halitosis coming back from the throat. After we've moved from the mouth, we're going to move to the neck. We're going to first start by inspecting the neck, making sure it's nice and smooth, making sure that there are no lumps or masses or anything like that. It's midline to the chest, and also no lumps or masses around the thyroid cartilage. We're also going to make sure that the patient can do active and passive range of motion to test the spinal accessory nerve. So if I could, can I have you bend your head forward, bend your head back, turn it to the left, turn it to the right, and then over to the side and over to the side. And now we'll do that against resistance. Good. And we're testing the strength here. It should be nice and even on both sides. Good. And good. We'll also test the shoulders here. Make sure that they're nice and symmetrical, good equal strength there. That also tests the spinal accessory nerve. After that, we're going to move on to palpating. We're going to palpate the trachea, making sure it's midline. We don't feel any tracheal tugging, no lumps or masses or anything like that. And then we're also going to palpate the thyroid cartilage, making sure that there are no lumps or masses there as well. Can I have you take swallow for me? Good, it's nice and symmetrical. And it is okay that the right side is slightly bigger than the left side. We're also going to palpate for the carotid arteries and the carotid pulse. And good, that's nice and even and symmetrical. It's not a bounding pulse, it's a good +2. And then we were also looking for jugular venous distension, which I don't see any of that on either side. After that, we are going to feel for her lymph nodes of her head and neck. So we'll start with the preauricular, the postauricular, the occipital, the tonsillar, submandibular, submental, anterior cervical, posterior cervical, deep cervical, which is along the sternocleidomastoid. Then we're going to do the infraclavicular, supraclavicular, and then we'll also check the axillary as well. And what we're looking for in all these nodes is to make sure that they're not raised or anything, which would indicate a sign of infection. We want them to be nice and discreet. All right. Finally, we're going to auscultate the neck. We're going to auscultate the carotid arteries and the thyroid cartilage, listening for any bruits with the bell of the stethoscope. And over the thyroid cartilage. Very good. No bruits heard. Next, we're going to move on to the shoulders, arms, and hands. We're going to inspect them for any lesions or anything like that, making sure the skin is intact, making sure that the muscles is symmetrical, making sure that there's no atrophy on either side. Also want to look at the nails, make sure that there's good capillary refill, no evidence of clubbing. Capillary refill is less than 3, so that's perfect. We want to also, after that, we want to test the strength of the arms. We already tested the strength of the shoulders, so we're going to test the strength of the arms. Okay, if you hold your arms straight out, push up, down, making sure that that movement's symmetrical in strength. And hold your arms straight out, up, and down. And again, that's nice and symmetrical. For the hands, we'll test the strength by having you grip both of my hands. Perfect, that's nice and equal. And then let's check the dexterity of your fingers as well. Touch your fingers to your thumbs. Perfect. And then now we're going to check the radial and brachial arteries, both for regular rate and rhythm. Want to make sure that these are nice and equal. And again, those feel great. They're nice and +2. After we moved from the arms, we're going to move to the back. The first thing when you notice the back, you want to make sure that the spine is straight. You also want to be looking to see if she's using any accessory muscles, both anteriorly and posteriorly, making sure that she's not really working to breathe, making sure that she's nice, even, and regular breathing. We're going to inspect the spine, making sure there's no evidence of kyphosis, lordosis, or scoliosis. You can also percuss the back, making sure that the back is nice and non-tender. So we'll percuss the spinal processes. And again, we can palpate around the spine too, making sure there's no signs of tenderness. And that seems to be good. We are also going to palpate the costovertebral angle while we're back here, making sure that there's no tenderness back there, and then we will percuss it as well. And that seems to be good. We can also check for thoracic expansion back here as well. Around the 10th rib, we're going to put our hands together and take a nice deep breath, and the thumbs move equally. Very good. Finally, we'll also check for tactile fremitus while we're back here. Can I have you say 99?
99, 99, 99, 99.
Very good. We can also check for diaphragmatic excursion while we're back here too. So can I have you take a deep breath in and hold it? Okay, perfect. Exhale. I want you to take another deep breath in, but then exhale. All right, and in between those spots, it should be 3 to 5 centimeters. It's okay that on the right side it'll be slightly higher than the left side, but let's do it on the left side too. Deep breath in and hold it. All right, and exhale. And then deep breath in and then exhale for me. All right, and then again, a good 3 to 5 centimeters is normal. Since we're in the back here, I'm going to percuss the lung fields, making sure to hit all the lung fields. And again, we'll do this in a systemic fashion. And then we're going to move laterally with our percussion. Turn to your side, please. Okay, and we'll do the other side. Perfect. And then we're going to do the anterior chest as well to finish off our percussion around the whole lung fields. We're looking for resonance throughout all these fields. Any hyperresonance would be an abnormal finding. Any tympany would be an abnormal finding. Any dullness would be an abnormal finding. All right, let's move back to the back one more time, and we're going to auscultate all the lung fields again, starting from back, going to lateral to anterior. Deep breath. Good. Again, looking for regular rate and rhythm, normal chest rise with these respirations. We want to hear nice, clear breath sounds. No adventitious breath sounds such as crackles, bronchi, wheezes. Good. And we'll do the sides now. Deep breath. Very good. And we'll do the other side. Deep breath. Deep breath. Deep breath. Perfect. And we'll go to the anterior chest now. So right now I'm only auscultating the breath sounds. We'll do the cardiac sounds in a bit here. So deep breath. All right, very good. Now that we've moved on to the anterior chest, we are going to. Oh, that's my eye. We are going to first inspect the anterior chest. We are going to make sure that the chest is nice and symmetrical, no axillary muscles being used, no increased work of breathing. It's not very hard to breathe. We also want to check the making sure that there's no pulsations or heaves to the chest. We are also going to palpate the chest, making sure there's no pulsations or heaves. We are then going to palpate the chest, making sure that there's no heaves or pulsations, and we're going to palpate the maxillary, or not maxillary, the apical pulse, making sure that there's no pulses or heaves there either. And that seems to be intact there. We've already percussed the fields, so then we're going to move on to auscultating the cardiac sounds. Can I have you face the camera, please? All right, we're going to start with the aortic, and this is the second intercostal space, right sternal border. We're going to move to the pulmonic, which is the second intercostal space, left sternal border. We're going to go to Erb's point, which is third intercostal space, left sternal border, the tricuspid, which is fourth intercostal space, left sternal border, and the mitral, which is the fifth intercostal space, mid-clavicular line on the left side. Again, we were looking for a normal S1, S2, no murmurs or bruits with that. Once we are done with the cardiac, then we are going to move on to the abdomen. We're going to start inspecting the abdomen with a light, noticing the contour of the abdomen, making sure that there's no extra pulsations, no lumps or masses that we can see, and that seems to be good. After we've inspected, we're also going to inspect the skin, making sure that there's no lesions or signs of infection either. After we've inspected, we're going to then auscultate all four quadrants, listening for peristalsis and gastric gurgling. Making sure to cover all four quadrants. And then we're also going to listen with the bell of the stethoscope, listening to the aorta, listening to the renal arteries bilaterally, listening to bilateral iliac arteries, and then the femoral arteries bilaterally as well. And there's no bruits there either. After that, we're going to percuss the abdomen generally, looking for tympany over the stomach. Any signs of dullness could indicate a mass or something like that, and that seems to be normal. We're also going to percuss for splenic dullness, which there's not any there. And then we're also going to percuss the liver borders. All right, so we mark that area, and then we go up. All right, and that the liver border should be anywhere from 6 to 12 centimeters, and that's normal, and it's right around the fifth intercostal space to the right costal margin. After percussion, we are then going to start light palpation. We're going to feel for abdominal muscles, any pain or tenderness, not going any further than 1 centimeter. We are then going to do deep palpation after that, and then this is more deep and more vigorous. We're going to circular motion, feeling the organs. We're going to feel the liver, costal margins. Can you take a deep breath for me and exhale? And the splenic costal margins. Good. And then we're also going to palpate the kidneys. Deep breath in and exhale. Good. Most likely we will not feel the kidneys, but if we do, they should be nice and dull, no sharp edges, not enlarged. And release. There you go. And then we're also going to feel for aortic aneurysms as well. A little left to the midline here. So go, just relax. And there doesn't seem to be any aortic aneurysms right there. Can I have you sit up? Next, we're going to move to the lower extremities. We're going to first check the extremities, the skin, making sure that the skin is nice and symmetrical, making sure the muscle mass is symmetrical, looking for any lesions, making sure that the temperature is normal and there's no edema as well. You can also check for capillary refill while we're down here as well. Then we'll move on to the pulses, checking the pedal pulses. And they're nice and equal, a nice +2. We'll also check the posterior tibialis pulses. And those are nice as equal as well. And those as well. And then we're also going to do the popliteal pulses, right behind the knees here. Nice even regularity with her pulse, nice +2. After that, we are then going to move to the neurological. We've completed most of the neurological assessment with our head to toe assessment previously, but what we're going to do is check for sensory sensation. So I have a sharp and dull object right here. Can I have you close your eyes and tell me whether or not you feel sharp or dull?
Sharp, dull, sharp, dull, sharp, 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 dull, 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 sharp, sharp, dull.
Very good. Next, we're going to move to the musculoskeletal, and we're actually going to check the reflexes here. We're going to check the brachioradial reflexes. So if I could just have you relax your arm. And good. We want to see pronation of the forearm and flexion of the elbow, which is what we just saw there. Good. And again, same thing in that arm as well. Next, we're going to check the popliteal reflexes, and we want to see extension of the knee. Very good. Very good. That was awfully aggressive. Next, we're going to check the Achilles tendon reflex, and we want to see plantar flexion of the foot, and that was perfect. And that was perfect. Finally, we're going to look at the musculoskeletal. We're going to look at the back of the patient. Can I have you stand and bend forward for me? Again, we're looking at the spine, making sure it's nice and straight. Going to check the cervical spine, the thoracic spine, the lumbar spine, and sacral regions, making sure it's not tender, which we already palpated for earlier, and no signs of lordosis, scoliosis, or kyphosis. We're also going to test the strength of the of the spine as well. Can I have you bend backwards, bend forward, side to side? Very good. And I'll have you sit down. And this completes my head to toe assessment. Thank you.